Good evening, Hattiesburg. Thanks for joining us for this COVID-19 briefing on Wednesday afternoon. Today we'll talk about test results for today. We'll talk about a couple of deeper dives into some local data that we're seeing. We'll talk about some things that Governor Reeves announced today in regards to a new order and, of course, our regular active courage. These are today's numbers and our cumulative numbers since this began from our four healthcare organizations: Forest General, Merit Health Wesley, Hattiesburg Clinic, and Simrai. Since this began, 12,326 tests have been conducted, 1,319 have come back positive, 10,326 have come back negative. We have 681 tests that are currently pending. In the hospital right now, we have 40 patients who are positive for COVID-19 between our two hospitals. That's up a little bit over yesterday and slightly above our 14-day average. In the ICU, these are the most acute patients right now. 14 people are in the ICU with COVID. That's several under our 14-day average, which is a good sign. Since about the third week of April, our hospitalizations have kind of landed between 35 and the low 40s. We're right at 40 today. Our ICU admissions, of course, we saw a peak of about 24 last week. That number has continued to fall. We hope that trend continues. Forest County added 8 new cases today to go to 511. Lamar County added 2 cases to go to 227. That brings the total COVID positive list for the metro area to 738. Of course, when we look at where the trends are headed, we look at a couple things. First of all, look at the 5-day average. This takes the number of new positive cases for a given day. It averages with the new positive cases for the previous 2 days and the 2 days after that. Of course, last week we had that aberration with the data reconciliation. We saw Forest County's number go up and then go way down. Lamar County's 5-day average went slightly above normal, but it's settled back into 2.4. Forest County right at 10 right now. We don't use the word recovered with our local numbers because to be clinically recovered according to CDC guidelines, you have to take 2 negative COVID tests after having COVID, which a lot of folks aren't willing to do. And so what we do is look at, considering this disease has about a 14-day or less lifespan, we look at the number of folks who have tested positive in the last 14 days versus the number of folks who tested positive outside of that 14-day window, of course factoring in the deaths. Forest County, of course, has 37 deaths, so the number of people who have tested positive in the last 14 days is 175. That could be considered what are your active cases, people that maybe still have this disease who could potentially infect others. The number of those outside of 14 days, 299. Again, that's a very imperfect estimate of the number of people who have recovered or survived. Lamar County's 69 folks have tested positive in the past 14 days, factoring in the 5 deaths in Lamar County. 153 tested positive outside of that 14-day window. And so this is a kind of a chart since the first part of April that gives what the 14-day inside total was at a given date. And so what you saw is toward the May 18th, May 19th, that number spiked. In Forest County, that number was 200. That represented the potential number of active cases. Again, as of May 18th, 200 people have been tested positive in the last 14 days. Well, since that time, people have cycled off that. That number's kind of fallen. And so, again, we're right in the middle of the 170s right now. Lamar County's kind of stayed between 50 and about 70 as well. Our overall goals with our COVID response: first of all, we want to protect vulnerable populations, people over the age of 60, people with underlying or chronic health conditions. We also want to prevent overrun of the healthcare system by slowing the spread so that if and when you need healthcare, there will be the personnel and equipment for that. And then finally, as we reopen, we want to prioritize public health while giving the private sector the space it needs to operate. 4 factors guide that reopening: the widespread availability of testing, which of course adding the C.E. Roy Community Center free testing site has helped a great deal. We've seen tremendous response and utilization of that. Secondly, the wearing of masks that we have in our community. Watching our own local data, we'll talk about that in just a second. And of course, listening to all voices, business and healthcare. Our local data, a couple deeper dives for you just to consider. In the past 14 days, 175 folks in Forest County and 69 folks in Lamar County have tested positive. But I want to look at that 175 in Forest County. Again, this is the number of people who have tested positive in the last 14 days, considering this disease has about a 14-day life cycle. And so that could be considered what the number of active cases are. What we will see, I think, over the next 2 or 3 days, just by looking at kind of where the new positive cases happen, you'll likely see that 175 start to drop because we had our 3 really biggest days of new positive cases on May 14th, May 15th, and May 16th. Those cases will move past their 14-day mark. That doesn't begin to say that all of those folks have recovered because, again, we have people in the hospital, people in the ICU. But to say that potentially the number of active cases are beginning to fall, and that may happen over the next few days, is an encouraging sign. We want that trend to continue because we want fewer community spreads. The second thing I want to draw attention to is ICU utilizations. We have 14 people in the ICU right now, and out of those 14 people, they're not all from Forrest and Lamar counties. In fact, they come from 11 different counties, which puts the likelihood of a lot of Forrest and Lamar counties actually to be kind of small. The average age is 64.8 years. There are people in their 80s who are in the ICU. There are people in their 40s in the ICU. And so what do we do with all this? What does all this mean? A couple things, a couple conclusions here. First, coronavirus is still a threat to the elderly and those with underlying health conditions. You can see that with the average age of the folks who are in there. We're getting word from people on the ground that a lot of folks that have diabetes, people who are obese, people with hypertension, people with lung conditions, those people are really susceptible to have adverse reactions. We need to keep that in mind going forward, particularly if you fall in that group. Second thing is, Hattiesburg is the hub for healthcare in South Mississippi, and we must be mindful not to overrun resources. When you factor in that people from 11, 12, 13 counties are coming to get their healthcare here, especially when things get most acute. As we go into the fall and winter, you're likely to see the ICU utilization go back up. We have to make sure that we're not overrunning the resources and personnel that we have. The third thing is, as we start to reopen, as we continue this measured approach, we have to find ways when people are getting out amongst each other again to reduce the risk of community transmission. Because again, reducing the risk of community transmission affects, not infecting the elderly, which in turn affects not overrunning the healthcare system. And that's done through, policies that we put into place that people faithfully go by, not for our sake, but for the sake of people around them, like wearing masks. But it also comes most importantly from your own good judgment, good common sense, and showing good personal responsibility. Where you go, how you act there, that's really going to affect where this goes in our community over the next several months. Today, Governor Reeves issued some new guidance that's going to take effect June 1st. The Safer at Home order will officially expire. The new order called Safe Return goes into effect, and we will give some more details on that throughout the week. But essentially, all businesses as of June 1st will be allowed to open to some degree with some strict health guidelines. All the things that have been closed, that not open until now, those things will get to open due to Governor Reeves' executive order on June 1st. Most current restrictions on restaurants and retail will stay the same. Not a whole lot will change for restaurants and retail. However, live music can return. I've received a couple of messages in the last few days about when musicians can get back to work and when artists can go back to doing what they love to do and what we love for them to do. And that can continue. There are some guidelines in terms of social distancing for musicians, but we'll go over those. The two biggest things are the gatherings. Right now, it's 10 indoors, 20 outdoors, and the governor kind of created today sort of two tiers where social distancing is possible, and I know this affects a lot of our event venues here in Hattiesburg. If social distancing is possible, an indoor maximum of 50, an outdoor maximum of 100, and so the example that he used on the outdoor piece is, kids, parents going to their Little League games. If you take into account the ball players there, and if parents will spread out in the stands and spread out along the fence line, he thinks 100 people, that can be done safely. In gatherings where social distancing is not possible, and he mentioned that these are the prevailing amount of events, social distancing is not usually possible. An indoor maximum of 20, an outdoor maximum of 50 are what he's going to set that limit as. Of course, again, he also reiterated the notion of good personal responsibility. And so going forward over this week, we will work with our partners at Visit Hattiesburg and our partners, whether they're in restaurants or hospitality or event venues, and to try and issue some guidance if necessary prior to that June 1st, when that order goes into effect. Our act of courage today, of course, this is an opportunity for you to get out and show courage. Extra Table is needing some volunteers to pack food boxes and bag rice to feed neighbors in need. That's going to happen this Sunday from 1 to 3:30 at the Cloverleaf Mall at the Old Trees and Trends. Masks must be worn, and there will be appropriate social distancing. If you would like to volunteer, you can even bring your kids. You can comment below or go to the Extra Table page and comment, or you can text Martha Allen, who's the director there, at 601-447-4667. A great opportunity for you to get involved and help those in need. As we continue going into the week, wash your hands. Please take care of yourself. Wear a mask if you go out in public. Do only what is essential. Remember, you're safer at home, and I know right now we really need to be kind to one another and really need to show courage, and hope you have a great rest of the day.